So this issue of quarantining when you come home is serious. This is not an advisory. This is your civic duty to your fellow Australians to stay home for that entire 14 days if you've come back to Australia. No exceptions. And if you see anyone who is not abiding by that, a recent traveller, make sure they do, because we are really serious about that. It is such a big impact on our outbreaks in the last few days. But we have also seen community outbreaks in a number of states. Again, we expected them. That's why we put in the social distancing measures first announced late last week and progressively further announced this week. They're expected to start hitting in about a week after they were first announced. We always expected a bit of a delay, but as the Prime Minister has announced, we have to make sure that people are very clear about what they mean. What we mean is that you should be distancing yourself from every fellow Australian where possible. That's why we have guidelines for people in gatherings of less than 100. It's no point having a gathering of 20 people if it's in a tiny room and you're all together. You've got to practice social distancing. Keep that 1.5 metres away from each other. Practice good hand hygiene all the time. And stay away from work or the community if you're unwell. This is also incredibly important. Whilst people who are high risks of contacts and return travellers, if they get symptoms, must be tested, there will be cases of community contact where it's not suspected and they might just get a sniffle or a cold, the sort of thing that many of us have soldiered through and gone to work in recent years. We can't do that anymore. Nobody should be going to work or mixing with society or friends or going out if they're unwell at all. Stay at home if you're unwell. Only go out when you're feeling well. Go to work when you're feeling well. Practice good hand hygiene and practice that social distancing at all times. This is critical now. We have to slow the curve, as the Prime Minister said. We are well prepared. We've had very few deaths so far. They're tragic, and we've had very few people in intensive care. But there is a risk that if we don't do what every one of us has to do as our civic duty to control this spread, it will grow significantly greater.